Welcome back, everybody, to the OPT Network. This morning, we're joined by Dr. Michael Leddy. He's been an orthopedic surgeon for well over 2 decades, and he's going to walk us through injuries and understanding them. And so many of us decide to self-treat. Probably not good. Now, as we are entering into football season and sports are coming back, sadly, a lot of young people will sustain injuries, and he's here to talk about what we need to know and understand about those injuries. Dr. Leddy, good morning and welcome.
Good morning. Thank you for having me.
Absolutely. So let's rewind, 20, 25 years ago. Why did you decide that you wanted to be an orthopedic?
Well, to be honest with you, I was the patient for a lot of orthopedic surgeons growing up. Played football, played rugby in college and in high school. Sustained a bunch of different injuries, some of them major, others just minor. And I always knew I wanted to be in medicine. So it really was just an attraction right off the bat. And the idea of being able to be a physician and still be around sports and be around athletes, it was exciting. In a lot of ways, you're sort of like a rock star a little bit. You got the best of both worlds. Sometimes you take care of high-level athletes. Other times you take care of high school athletes. It's a fun thing because most of the time your athletes are healthy, they're younger, and they bounce back pretty quickly. But over time, things will change a little bit, and you realize that there's a lot more involved in being an orthopedic surgeon.
I said at the top of the show that we're coming into football season, but now kids are playing earlier, and they're no longer seasonal sports. Sports now are year-round. Talk about the stress and the wear and tear that young people are putting on their bodies so early, especially those kids that want to be pitchers.
Sure. So one of the things that's kind of interesting is I always tell people to just look at professional sports. There's a reason why there's an off-season for professional sports. It's not because guys like to go play golf or to do other activities. It's actually to give their bodies a rest. So what we're facing right now across the United States is it's an epidemic. We have kids that are playing 11 out of 12 months. They're going from one league to the other. And what happens is during that time, their bodies just don't get a chance to catch up. It's always interesting to me that in Major League Baseball or Major League Sports, the athletes are fighting to play less and have more time off because they're concerned about injuries. One of the funniest things is that 25 years ago in baseball, the collective bargaining agreement it eliminated doubleheaders. And me growing up, a doubleheader was great because you'd go to Yankee Stadium and you used to get a baseball bat and you'd get 2 games on a Sunday with your family. And they eliminated that. But as they eliminated that, now our young people are playing 5, 6, 7, 8, 9 games in 3 days. So why is it that our professional athletes are looking to play less, but we're making our younger athletes during their most important ages of development play more? And that's just something that sort of befuddles me a little bit, and why myself and a lot of other orthopedic surgeons are trying to do things to change that.
And so what sort of things are you all doing to change that in the realm of seeing these kids with shoulder and, I guess, elbow injuries?
One of the things that we've tried to do through a lot of different organizations, including Louisiana Orthopedic Association and the American Orthopedic Society of Sports Medicine, is we've gotten out there and we've tried to educate parents. Unfortunately, a lot of times the education comes when they're actually in my office, when the child is actually having shoulder and elbow pain. We've done extensive research. One of the most well-known doctors in the United States and around the world is Jimmy Andrews. Jimmy's actually from Homer, Louisiana, and he was the high school pole vaulting champion in Louisiana. But he's the most prominent orthopedic surgeon around. And he started the STOP movement. And that was basically research that he did at his institute, talking about pitch counts, talking about days off, what type of pitches to throw. It significantly changed a lot because back 10 years ago, they would go by innings. They would say, okay, a pitcher could only pitch 3 or 4 innings. Well, the problem is if you had a bad outing, you could have 30 pitches in one inning and 10 in another. And so by doing pitch count and saying how many days you could be off and relating it to the age of the patient, we're trying to protect those young individuals. The problem is that there's no national norm. Every state has a different number, and every state reacts differently to it. So the best thing you can do is just try to educate the players at high school levels, travel ball levels, and do the best you can.
And so let's talk about what happens and why there will subsequently be an injury for many young pitchers. And I'm just talking about kids right now. I'm talking about those young kids that are playing 11 months out of 12, that are playing high school ball. Why are they getting injured?
Well, one of the things that a lot of people don't think about is the genetics. You know, we were talking a little bit earlier. I always say professional athletes is 50% of God coming down and touching you on the nose and saying, this is what you're going to do, and 50% is genetics. A perfect example is if you look at football, if you have somebody who's about 6'10", 6'11", and is 330 pounds and has ballerina feet, he's a left tackle. If you're 200 pounds and about 6 feet tall and you're not afraid of anything, you're a fullback or you're a running back. 6'5", 240 pounds, 250 pounds in catch, you're a tight end. Basketball, you're 7 feet tall, you're a center. Well, let's line up 20 kids. We have a male, a female, red hair, brown hair, blue hair, black, white, Hispanic, Korean, someone from Lithuania, someone from South Africa, Canada, or Brooklyn, New York. And you line them all up, fat and skinny. Which one's the pitcher? You can't tell. All of them could be the pitcher. The pitcher is the one whose body can actually withstand the beating of throwing. And we know from the mechanics of throwing that overhand throwing is not the natural way of doing things for humans. It's actually underhand. It's the reason why softball and baseball are so different. Wow. It's the reason why softball pitchers can throw all day and baseball pitchers can't. It's one of those things that during these times, the growth plates are changing, the muscles are getting bigger, and everyone matures at a different level. And if your mechanics are not strong and you're not doing the proper technique, you're going to have an injury. One of the interesting things that somebody told me one time is, particularly when it comes to pitching, 98% of our young kids, whether it be from 8 years old to 15-year-olds, they're not pitching. They're throwing. The art of pitching is actually being in a situation where, say, it's 3-2 and 1 out and a runner on first base. And you have a batter up there that doesn't like it low and inside. What pitch are you going to throw and where are you going to throw it? That's the art of pitching. As opposed to, I'm 10 years old, I'm the pitcher, there's the batter, and I'm going to throw this ball as hard as I can because he's going to swing as hard as he can. It's that mentality that at that age seems sound, but it's not. I always tell everyone that the most deadliest pitch you can teach a 10-year-old is a changeup. Because if you can teach them a changeup, which is really easy on your arm, and you make it look like you're going to throw it as hard as you can, and you don't, you'll make everyone look silly. But it's just getting over that. And I think that's one of the things that sets everyone up. The other thing is that there is this idea that the more you play, the better you're going to be. And that's just not the case. It's actually the more you play, a lot more likelihood you're going to have an injury or you're going to break down. And playing year-round, again, it just doesn't let the body heal itself. It doesn't let the mind heal itself. And that's an important thing because there is burnout. There is athletic burnout. And for as many kids that I see that are injuring their shoulders, their knees, or any other part of their body because of overuse, there are also that many kids out there that are quietly struggling with the fact that the sports are tiring them out and they don't know how to go to mom or dad or to their coach or their players, teammates and say, I just need a break. I just need to be a kid for a little while. That's one of the things I usually tell the kids if they're coming back from an injury. I said, yeah, I know you're going to be out for 3 or 4 months, but you're going to be a normal kid now. So, you know, just chill out and hang out and do some normal things as opposed to every weekend being on the road for a tournament or every day working out. So I think that's where a lot of it starts. It's just the education and the mentality of where they are at that point.
Absolutely. That's a lot to think about. We're going to take a break here, but when we come back, we'll talk about those injuries and when we need to go in and see an orthopedic surgeon and what's the healing process. Dr. Michael Leddy is our guest this morning. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. You know, it's not every day that we have these conversations about our joints and what we need to understand. So we're always grateful to our friends and partners at MidState Orthopaedic when they give us the time to share with all of our listeners and viewers about understanding our joints and those injuries that, if not taken care of properly, could really create problems. And here to talk about that this morning is Dr. Michael Leddy. And Dr. Leddy, I want to go back to the kids because a lot of kids sadly will be injured. Once they're in that healing process, will the body restore and renew itself in a way that allows those kids to go back and play? Because, kids are playing for all sorts of reasons, and they want to play, a lot of them.
Absolutely. I think one of the things that's great about kids is I call them rubber balls. You throw them around, they bounce around, they bounce back. When I was a kid, they had these things called weebles. You'd hit them and they'd wobble around, but they
don't fall down.
Exactly. So that's what kids are like. And when you're younger, your body responds quicker to injury. Many times, kids who fall and break their arm 5, 6, 7 years old, within 2 to 3 weeks, they've got new bone that's laying down, and they come back and see me. We take their splint off, you push on it, and they want to go back and do everything right away. You still got to slow it down because there is a process with it, but kids seem to bounce back quicker. So a lot of times, when they're still skeletally immature, and that's usually before puberty, their recovery is a little bit quicker. Once they get to skeletal maturity, they still will bounce back quicker, but in the same sense, you still have to follow the protocols, say you would for an adult. And that's one of the things that is really difficult when you're dealing with young athletes. They're so eager to return. They'll do anything to return, but a lot of times it's just time. For example, you tear your ACL, unfortunately, and that's something that happens a lot in football, but it also happens a lot in women's soccer, and a lot of people don't realize there are a lot of girls in town that tear their ACLs. They are ferocious athletes. They are out there going 110 miles an hour, and sometimes I think it's because they feel that they're overlooked and that they want to prove things, and sometimes there's just a little bit of a mean streak in girls when they're playing, and that competitive streak is great. But if that does happen, you have to remind the parents, and you have to remind the coaches, and you have to remind the player that if you're Adrian Peterson, and when I was in Minnesota, I had the ability to and the honor of actually seeing him and meeting him. Adrian played for Oklahoma, and he was a world-class running back for the Vikings. He tore his ACL. It took Adrian Peterson 10 months to get back on the NFL football field. That's 10 months with his only job of rehabilitating that leg and getting ready. So sometimes I'll joke with the players, and I'll say, hey, listen, you know what? You're a great athlete, but you're no Adrian Peterson. Because why would you think that a 16-year-old who's playing, say, at Menard or Pineville can recover from an ACL injury faster than Adrian Peterson? It's not feasible to do. And I think when you sort of bring it into that context and they realize that, and you say it about somebody that they know, they're more accepting of it. I think the other thing is you got to be honest with the parents. You got to be honest with the kids and say, hey, listen, this is going to be 9 months. This is going to be 8 months. This is going to be 5 months. Because if you give a false idea of when they're going to return, then you're setting yourself up for disappointment, and you're setting yourself up for them to think that they're ready to go out and do something that's going to set them back.
So why did you decide to specialize in shoulders and shoulder injury?
It was something I sort of just gravitated to. I love taking care of knees. I do a ton of meniscal work. I do a ton of ACL work. But at that point, there was a need, and I made a deal with them. I was a young orthopedic surgeon looking to build my practice, and I said, okay, listen, I will take all the bad shoulders, the ones that none of you want to do, and I'm going to learn how to do it. I'm going to go into the lab. I'm going to work on cadavers. I'm going to go to courses, and I'm going to learn how to do this, and I will give up total knee replacements. But if you're going to send me the bad ones, I want the other ones as well. And they were kind enough to do that. And that's the way my practice started. And when I came to MidState, I made sort of a similar deal. And over time, it's just gravitated to shoulders.
Why do shoulders go bad?
There's a lot of things. Number one, it's genetics. We wear them out. Most of the rotator cuff tears that I see in the population are just rotator cuff tears that have just happened over time. Sometimes it has to do with other medical problems such as diabetes or rheumatoid or just osteoarthritis. The other is overuse, like we say with baseball players, volleyball players, softball players, just the constant motion or the wrong mechanics. And then the other thing is trauma, is where you're in a car accident, or you get hit in the football field, or you land the wrong way, or fall off your bike. That's where the injury occurs. And each one of them has a challenge. Each one of them has a good prognosis. Each one of them has a concerning prognosis. And a lot of times it has to do with what else is going on with the patient, if they have other medical problems.
So when there is a tear, let's talk about what actually tears, how you repair it, and what is the healing process?
Sure. So, for instance, there's two major structures that will tear in the shoulder. The first is called the labrum, and what the labrum is, it's like almost like a suction cup. So we have this cup right here, okay? So imagine that this is the gliding surface of the shoulder. There's a suction cup that goes around it and expands the surface area, almost like a splash guard. And when the ball of the shoulder sits in it, it sort of stabilizes it and keeps it where it is. That can tear from overuse, or that can tear in a traumatic event where the shoulder is dislocated. The other major structure, and the one that a lot of people dread hearing about, is the rotator cuff. And the rotator cuff is a set of 4 tendons that actually hold the shoulder in place and allow you to bring your shoulder internally and externally rotated, but stabilize the shoulder. Those can tear from falls, those can tear from injuries such as car accidents, but for the most part, a lot of times it's just overuse and wear and tear and repetitive things. Now, the important thing to understand is just because you have a tear does not mean you're going to surgery. In fact, for the most part, I would say 60% of the people that come in with some type of tear in their shoulder never see my operating room. And the reason why is I'll treat them with anti-inflammatories, with an appropriate injection, or we'll set them up with a good physical therapist to build the other structures around their shoulder. A lot of time it's just inflamed. And if you can calm the fire down, they can go about doing things. Because I always tell patients, when you are looking at shoulder surgery, whether it be a labrum or a rotator cuff, realize it's at least 6 months recovery. Now, that doesn't mean you can't do anything for 6 months, but it's 6 months out of your life that you are going to be recovering to the point where we hope you're back to where you were before your injury. And a lot of times with people that are working, mothers who are taking care of young children, folks that are taking care of their family members that have other health needs, that's a difficult thing to do. So for me, I try as much as possible to keep them out of the operating room. Sometimes you can't. Sometimes it's so acute, whether it be a fracture or a traumatic injury where the shoulder is so loose that it continues to come out of place. You have to fix them right away. But sometimes the patient will just come in and say, "Doc, it's not working. You need to fix this thing." And at that point, it's kind of nice because the patient realizes we've done everything possible to stabilize the shoulder or fix their shoulder. And now they are accepting of the fact that they're going to the operating room. I always tell patients, I want you to be ready to go to the operating room. I don't want you to think that I talked you into going into the operating room. It's one of those things where if people are all in on something, the results are going to be great. Even if it's the right thing you're going to do, if there's some doubt, either number one, they're not ready for it, or number two, you did not do your job to make sure that they are at the point that they want surgery.
Let's do this. Let's take a break here. But when we come back, I want to talk to our older patients, our more mature patients that maybe had a fall and are concerned about that shoulder and what should happen. Stay on point, everybody. We're back with more right after this. Welcome back, everybody, to the OPT Network. This morning, we're talking about those injuries that sadly none of us want to have. But if we do, we want to make sure that we're connected to MidState Orthopaedic, who is really on the front lines of taking care of our community and many people in central Louisiana. Dr. Michael Leddy is our guest this morning. He's a surgeon at MidState Orthopaedic with vast experience. And we're just picking his brain because we know that a lot of people have injuries. A lot of people self-treat. And so then we have people who say, well, it just feels sore. I think it'll be okay. When do you know that you need to go in to see an orthopedic surgeon?
Well, a lot of times somebody will have a slip or fall or wake up and their shoulder's bothering them. I always think that it's jumping the gun to immediately call the orthopedic surgeon. And I think, a little ice, a little heat, anti-inflammatory over the counter, that it's appropriate for you. If you can take it and it's not going to affect any of your other medicines, is fine. I always get concerned, and I always tell patients to be concerned if they notice that they're having a significant loss of strength, or a continuous loss of range of motion. That's when you're starting to see, okay, there's something there or something's going on that's
And
just
that
not
range
right.
of motion is lifting.
It's lifting, but the one that is really and truly the one I see the most, it's actually called internal rotation, and it's actually reaching behind your back. Women always tell me I can't button my brassiere, I have to do it in the front, and men tell me they can't reach their wallet.
Wow.
And it's a constant thing. And that's when the bells start going off is, okay, there's something a little bit more here that maybe we need to take a look at. Now, one of the things, and I think we talked about it a little earlier, is I want to stress is, just because you're going to the orthopedic surgeon, don't think that you're going to surgery. A lot of times I think that scares patients. They hear the term orthopedic surgeon. I think if we were orthopedic doctors, they wouldn't feel that way. But they hear the term surgeon, and right off the bat, they're thinking surgery. And like I said, most of what I do has nothing to do with the operating room.
When did you get to the point where you made a decision practicing that you would allow the body to heal itself or allow the patient to get there before you would recommend surgery?
I think it was early on, because when I came out of residency and I came out of fellowship, like many physicians, and I will be quite honest, I thought I could fix everything. And there are times where I would go in and I would operate on patients, and I thought I did the greatest surgery in the world, and the results just weren't as good as what I thought they were. And a lot of that had to do with healing, a lot of that had to do with other comorbidities. And being able to sit down and talk to my partners and talk to my colleagues and be honest, but also listen to their experience, that's where everything changed. And I think every surgeon goes through that a little bit. It's important to be able to sit and listen to your colleagues and be able to self-critique yourself and look at your results. I learned a tremendous amount from my partner, Mike Brunet. I learned a tremendous amount from my partner, Christopher Rich. I learned a tremendous amount from David Fisher up in Minnesota. And I think any physician, no matter what field that they're in, they should always take advantage of that knowledge, because at 20 years out, I now have physicians calling me and asking me about it. And it's now my time to pay back to the younger generation and let them know that it's okay to keep your knife in the pocket. Let the body heal, and it will tell you when it's time to fix something.
Will the body heal? Will a shoulder heal certain injuries or certain challenges that you may be having with your shoulder? Can it heal on its own?
I wouldn't say heal all the way, but the body can manage itself. I have a lot of patients that have full thickness rotator cuff tears, and their function and their range of motion is excellent. They have a little bit of pain here and there, but they can tolerate it. And my thing is, if I can't make you any better than where you are right now, I'm going to be honest with you. Because if I can't make you any better than where you are right now, I have no business operating on you. If something changes, then you and I can have a discussion as to what the pros and cons are. And are we at a point where the benefit of surgery far outweighs the risks of surgery? And I think that's kept me out of trouble for many, many years, is just being able to be honest with myself and honest with my patients.
So just for the everyday human being, because God willing, we all have shoulders and elbows, is there a way to take care of those joints, or do they all just over time eventually wear out?
No, stay active. Patients should stay active. I always tell people, if you have arthritis, stay active. Your arthritis is still going to be there, but if you can keep your joint capsules open, you're not going to lose your range of motion. Stop smoking. Smoking is horrible on joints. It's horrible on bones.
Is it?
I always tell patients, we have studies out there. If I'm going to operate on, say, your rotator cuff, if we fix it, should be healed in 8 weeks, where we can start doing things. If you smoke, it's 12 to 16. If you break a bone and you're a smoker, add 6 weeks onto your healing process compared to someone who doesn't smoke, who is the same age as you. Watch your weight. Diabetes affects soft tissue healing. There is a higher risk of non-healing in a rotator cuff or failure of a rotator cuff surgery in patients who have uncontrolled diabetes. It's things like that, again, that a lot of people at the time, the public doesn't know about. But smoking and diabetes are the two toughest things that I have to face in fixing some people, and I'm honest with them about it. Smoking can be fixed, diabetes can be maintained. And if they can do that, it makes my job easier, and in the long run, it makes their job of healing easier.
What has surprised you most over these 2+ decades that has changed in the field, that has become so advanced that 20+ years ago you thought,
You know, medicine is changing so fast. You know, we can talk about, you know, the COVID-19 vaccination. Everyone asks me, well, they rushed it. I tell everybody, you got to remember when Jonas Salk found polio, it was by accident. Penicillin was a mistake. And remember, these guys were there with slide rules and mounds of paper and microscopes, compound microscopes that we used in high school, and they were able to develop this. Our cell phones change every 6 months. That's how much technology is changing. So when people say, well, they rushed the virus, I'm like, that's awesome that they were able to get the vaccination that fast. And it's the same thing in orthopedics. I think the thing that has amazed me the most, there's two, is number one, our plating system to fix fractures has gotten so much better. It's revolutionized because we've developed a way of when we put the plates in, we used to put the plate down and then screw the plate to the bone. Now we have screws that actually screw into the plate and the bone, and it stabilizes it more. For me as a shoulder surgeon, though, it's shoulder arthroplasty. It's shoulder replacement surgery. 15 years ago, patients that had a rotator cuff tear that they could not fix, it just was irreparable, and had horrible arthritis, they were stuck with shoulders and pain, and this was all that they can do. Now today, reverse arthroplasty, it takes me about 45 minutes to an hour to do, and it's an absolute game changer in our population over the age of 60. Patients that have been suffering for pain that didn't have any answer before. When we first started doing it, we were limiting it to patients who were 75 and above because we didn't know if it was going to fail or how it was going to work. And remarkably, just with a couple of new techniques and what we call generations from the first time it came out to the second, we're on the third and fourth. We've lowered the age, we've lowered the we changed the indications for it. It's patients that are in constant pain for 8-10 years that now come in and they're like, within 2 weeks, I feel better, I can move my arm. And I think that's the most rewarding thing for me, because as I came out and I started developing my practice, that technology came out right away.
Wow.
And I jumped on it, and I've now done probably close to 1,200 of those. And every time I do it, I look at the patient, I have a joke with them. I said, in 2 months, I'm going to ask you, are you happy that you had it done? And I'm not going to say I'm perfect, I'm not. But I would say 98% of patients come in. There's nothing like getting a hug from a patient. There's nothing like a patient saying to you, I'm going to tell everyone about you. The greatest gift that you can give your physician is the idea of being able to go out and tell your friends and family to go see that physician. If you have the confidence in that patient to do that, that's the best feeling in the world.
Amazing. Dr. Leddy, thank you for taking the time, and thank you for all that you're doing to be the change that you want to see in fixing those shoulders. Thank you so much.
Oh, thank you very much for having me.
Indeed. Hey, everybody, stay on point. We're back right after this.